Underneath the ultrasound machine, you will find sterile sleeves. These sterile sleeves are used to cover the ultrasound probe in a sterile fashion. You will find the sterile sleeve with picture instructions, sterile ultrasound gel that can be used during the procedure, a tape to wrap up the sleeve, as well as some elastic bands which can be put around the transducer cord to make the sleeve less floppy. Here's the ultrasound insertion process. Have your assistant place some gel on the probe and help you place the probe within the sterile sleeve. Make sure that the probe cord is well covered, and then use the tapes and elastics that come in the probe sleeve covered kit to make sure that the sleeve is well attached to the probe. Place the probe in such a way on the Mayo stand or the patient's bed such that it will not slip off and contaminate itself or fall on the floor. Chlorhexidine is the preferred prep. It must be applied and allowed to dry before the line is inserted. Prep the area widely to ensure that the whole area is covered. Maximal barrier precautions requires you to use full body drapes to totally cover the patient and the surrounding area. Local anesthetic should be used and to anesthetize the skin and area of the insertion. The ultrasound is used again to identify the vessels of interest. The vein is identified by its compressibility under the ultrasound probe. Doppler and M-mode can also be used to identify the vessels. The depth of the vessel is compared to the depth markers on the side of the screen. Keep the vessel centered over the center of the probe in the middle of the screen. This is the axis the needle will take. Keep the needle in the center of the probe. Advance it into the vessel under visualization, remembering that the tip of the needle may not be visible if it is not in the plane of the transducer. To document the use of ultrasound for central line insertion, a picture must be preserved of the needle within the vessel. This can be done by printing it out using the print button on the ultrasound machine, or if a DVR recorder is attached to the machine, this image will be preserved on the DVD. If it's printed out, the image must be kept in the patient chart. This can be placed on the back of the procedure note and scotch taped in place. Alternatively, the images can be stored on a medical DVD recorder. Once the needle has been safely located within the vessel, advance the wire through the catheter. Use a dilator if required. The skin may need to be nicked for larger catheters to allow its passage. Advance the dilator into the vessel and then withdraw it, and advance the catheter over the wire into the vessel. Remove the wire and make sure that it's entirely removed. Get flashback and flush the catheter. Use a small catheter as necessary. Avoid the use of stopcocks. Suture the catheter into place. There is one more step before applying the dressing. An antimicrobial biopatch should be applied to the puncture site around the catheter. After the dressing is applied, a chest X-ray is ordered before the line is used to confirm its location. Documentation that needs to be completed includes the invasive procedure note with a timeout indicated as being completed, the location of the line, the diagnosis and indications for the procedure, the type of preparation that was done indicating that the central line insertion practice bundle was followed, any medications that were given, the use of what type of catheter, the location, whether ultrasound was used, the vessel and the condition it was found in, how many puncture attempts were made, whether or not the needle was seen on ultrasound, adding the imaging to the back of the sheet if that is required, and indicating whether or not it's a new site or it's a rewire. Complications should also be recorded, and the note needs to be signed both by the resident and eventually by the attending. Another form needs to be filled out very briefly. That is the ICU ultrasound QA form, which is used to Keep track of ultrasounds for QA purposes and for credentialing purposes. On this form, indicate who actually held the ultrasound probe, who the attending was, the type of ultrasound that had been performed, indications and findings, and any issues during the ultrasound insertion. In review, central line associated bloodstream infections are preventable, increased costs over $25,000 per stay, increased mortality, are tracked and are available on the internet for all to see, and Medicare and insurers will not pay the additional costs. Clip or central line insertion practices are tracked by the state. These include hand hygiene, maximal barrier precautions, use of chlorhexidine, which must be dry before the line puncture, and use of antiseptic discs or BiPatch. Ultrasound, remember, pre-prep survey to ensure the vessel is patent, use a sterile sleeve, confirm the vessel location by compressibility color flow Doppler, use a depth scale to see the depth of the vessel, center the vessel on the screen, and then center the needle on the probe. Watch that needle enter the vessel and print that picture for the chart. When completing documentation, you must have a consent, evidence a timeout and that clip was followed, the diagnosis, indications, whether it was a new site or you rewired an old site, the sites that were surveyed, punctured, and the number of attempts, indicate whether you imaged the needle entry, whether or not the wire was removed from the patient intact, the type of catheter used, and what follow-up studies such as chest X-ray were ordered.